It was a COVID, and my annual exam had been kicked down the road for a couple of reasons, so it was past the year. I couldn't get into my annual exam until January, so I'm like, hey, at least let me get the mammogram in, right, for the holidays. That was December 4th. The clinic called that afternoon and said, you have a suspicious mammogram result. We need you to come back for more testing. And by Wednesday the following week, I knew it was cancer.
She called me up and said, let's go grab a glass of wine. Your first feelings is shock and disbelief. You kind of ask yourself, why? Why us? Why her? Your mind leads you to doing some things that you shouldn't be thinking about, but you do, until you get some answers.
By December 23rd, we, I think, said it was our Christmas gift, we had our plan. That was a pretty tumultuous couple of weeks, just not knowing what the future would hold, not knowing what the treatment plan would be. We're planners, and so, what is the next year gonna look like? Our medical professionals just kept saying, trust the process. Once we get all of the results, you'll get your treatment plan and you'll feel a lot better. And it was like magic, that we got our treatment plan. But then we also knew that probably our biggest test was telling our family about it. These two plus our third daughter, our most precious family members, what the diagnosis was, because we knew it was going to rock their world. So we get through Christmas, and then the day after Christmas, we had a family meeting.
It was a hard 2 hours that we sat in that room and did a lot of crying together, and talked about it.
I remember just at first I was in shock. I think me and all my siblings were. We didn't really know how to react or what to process.
They just came straight to the point that she had breast cancer, and we all knew that. We were all really sad about that, and I was just worried that that other stuff could happen.
But then once they explained everything and explained how the treatment was gonna go, because they had the plan already, it reassured you, and you had in your mind that it was all gonna be okay, because they know what they're doing. They're specialists.
I think the great thing is that we had a plan, and we're gonna need to be a team.
There's been a lot of data that looks at what's important to a patient in general, and the most important thing is that patients feel that they're a person, not just a patient. So I treat them as an individual and do everything that I can to get the care that they need.
You develop a really special relationship with your oncologist. I mean, they are busy people and have many patients, but Dr. Pro was never too busy to stop, listen. She knew that care meant not only your physical care and your plan, but also, that there's a whole other side, right? The people side, and that you're a person, right? And you don't just go through the motions. I look at the website, the Bliss Cancer Center website, and I think of all of those resources, and I think I could cross off at least 90% of the pieces I've taken advantage of. We relied on all of our resources, Dr. Glass, the psychologist on staff at Bliss, along with Angela. She was amazing.
The first 30 minutes, she just imparted all this knowledge and advice to us. She said, Jenn, you don't want to be remembered or known as a cancer patient. You want to be known as mom, professional, friend. Go out and do whatever you want to do. And I think that set the course for the attitude that you took, and that cancer wasn't going to beat you, you were going to beat it, and she gave us that permission to do so.
Our services are comprehensive here at the Cancer Resource Center, and we actually do a very multidisciplinary approach with our patients, so that both the physical, psychological, and genetic issues that come up are addressed. So when someone comes to the Cancer Resource Center, what we like to say is that they are being treated in a whole way, in a holistic way, by all of the disciplines that we have here.
We were able to work in a meeting with Dr. Glass in conjunction with the test I had the next day. When you have these urgent things that interrupt your life, you feel really reassured when all the medical professionals are able to be there and provide you care in a timely manner. Getting into a psychologist can take weeks, and we were able to talk to Dr. Glass within 24 hours. So
the one thing that we all learned is that when people want to help, it's okay to accept their help. And it was so great to see people, whether it was family, friends, neighbors, colleagues, college classmates that showed up at the door wanting to do anything that they could. And so for us, I think that big turning point was accepting help.
I think we have become a lot closer.
I FaceTime my parents every single day. I still do. That helped just to keep me updated.
During COVID, every day we would go on a family walk just to take a break from our studies, from our work, get away from our laptops.
We're a team, and the team is what's going to get us through this all. And it's not just with this situation that we have been through. It's every day, you know. And I think that's what we want these two and their older sister Annie to take away when we're long gone, is that it's the value of family, it's the value of each other, and it's the value of people that you form relationships with. So.